Hello, nursing aspirants. How are you all? Today I'm here to share the information like these previous questions which is asked in AIMS and JIPMAR. These are the case scenario based questions related to the neurological system. In this case scenario based questions, we have to find out the appropriate or correct exact answer depending upon the critical thinking. Like we have to standard methods like nursing assessment, diagnosis, planning, like that, nursing process, like next Maslow hierarchy needs, next critical decision making, and appropriate answer should be selected. Here the options are will be same, and but we have to select the appropriate answer. We will find out the answer by the nursing process, Maslow hierarchy needs, critical decision making, critical thinking. These will be applied in the case scenario based questions. Let's see the first question. The client has a sustained traumatic brain injury secondary to the motor vehicle accident. Which signs and symptoms would the emergency department nurse expect the client to exhibit? Here, secondary motor vehicle and traumatic brain injury. Which signs and symptoms of the emergency department nurse will be expected? Here, the first option is blurred vision, nausea, right-sided hemiparesis. We will expect these signs in the trauma of the brain injury. Increased urine out. Here, positive Babinski sign also will be seen in the traumatic brain injury. Here, next autonomic dysreflexia, positive Brudzinski and hyperpyrexia. These signs will be seen in the spinal cord injuries, not in the traumatic brain injury. Negative positive dextroscopic. Here negative given positive dextroscopic and neutral rigidity will be seen in the um, meningitis conditions. So here the correct answer is here second option. This is not a positive Babinski. Positive Babinski will be seen in the traumatic brain injury, like brain injuries. So here the correct answer is um, blurred vision. Blurred vision, nausea, right-sided hemiparesis is the correct answer in this question. Next, let's see next. The intensive care nurse is caring for the client diagnosed with closed head injury. What is this closed head injury? It means severe head injury. Severe, like connected to the any object. Severe head injury. Which data would warrant immediate intervention? Here some data are collected by the nurse. Which data will be immediate intervention? Means the client refuses to cough and deep breathe. This is second. The client complains of frontal headache. It is common in the head injury. The client mini mental status is, this is the normal mental status examination. Normal mental status examination. Here the Glasgow Coma scale goes from 13 to 17. The normal Glasgow Coma scale value is 15. The normal Glasgow Coma scale is 15, but here the client Glasgow Coma scale is going 13 to 17. So this is the immediate intervention of the nurse. So here answer is the client Glasgow Coma scale goes from 13 to 17. Next question. The rehabilitation nurse is caring for the client with closed head injury. Closed head injury means severe head injury. Which cognitive goal? Cognitive goal means the activities which is cognitive means nothing but learning, attention, knowing. We have here closed head injury means the activities also will be lost by the patient client. So the rehabilitation nurse will be regain the everything activities, cognitive skills like that would be most appropriate for this client. Here The client will be able to feed himself, herself independently. It will be take more time. The client will attend therapy 3 hours. It will not happen in normal person also. So the client will interact appropriately with the staff members. It will happen. It also happen. It will take some time, but the notes will be expected. Most appropriate for this client is the client will be able to stay task for 15 minutes. ఒక టాస్క్ లో 15 minutes he able to stay attention. That is appropriate cognitive goal of the rehabilitation nurse. So the correct answer is fourth. Here the intensive care nurse is caring for a client diagnosed with total brain injury who is exhibiting decorticate posturing. 3 hours later, the client has flaccid posturing. Which action should the nurse implement first? Here, intensive care nurse. Here, already total brain injury. But what is this decorticate posturing? Here I am showing. Here, pointed and turned in toes, rigid, extended legs, the arms bent towards the center of the, like baby, like a small baby. This type of posturing. First, the nurse identified this posturing. After 3 hours, the client has flaccid posturing. Flaccid posturing means it is the type of paralysis. There is the loosening of the muscle strength. The muscles should not able to um, unable to do activity. Type of paralysis. So what the nurse should implement first? Notify the healthcare provider. Yes, of course, this. Next, prepare to administer mannitol on osmotic diuretics. First, first, after 3 hours, again the client has flaccid posturing. So never do without prescription this type of administration. First we have to intimate the data to the healthcare provider. Next, complete a thorough neurological assessment on the client. First we have to identify the you notify the client's healthcare provider immediately. Then we have to do neurological assessment, reassess the assessment after 1 hour of the Glasgow Coma scale. So here the correct answer is first action should be taken by the nurse is first, as a nurse, after 3 hours the client have flaccid posturing means we have to notify the client to the healthcare provider. After that we have to neurological assessment. After prescribing the drug we have to administer. After 1 hour we have to do the Glasgow Coma reassessment. The first action should be taken by the nurse is notify the client's condition to the healthcare provider immediately. Next, the emergency department nurse is entering the room of the client who was at a baseball game and was hit in the head with a bat. Which intervention should the nurse implement first? Here, here already here mentioned first intervention. Which intervention should the nurse implement first? Assess the client orientation, date, time, place. It will be also do. Ask the client to squeeze this one also. But here move his lower legs. It will be do. But here asked first intervention. First implement intervention. After here, determine the client's reaction, the door opening. When the nurse came into the room, the door will be open. How the client is responding to that action first, as a nurse, that minor actions also she will monitor while taking care of this type of neurological conditions. So the first action the nurse should be identify, determine the client's reaction to the door opening. After that, we have to assess the clinical orientation, time, place, squeezing the fingers, and request the client to lower the legs. Next question. The nurse is preparing the client diagnosed with head injury for a magnetic resonance imaging. Everybody know how the MRI scan will be taken, how the setting of that one. There is so much sounds and there is a closed place. Someone who will have phobias, then definitely fear about that and feeling anxiety about that place. So here already the client is head injury. Which intervention should the nurse implement? Select all that apply. Here, ask the client if she has claustrophobic. Claustrophobic means fear of the closed spaces. Here, of course, this MRI will be happen in a closed place. There is so much sounds and magnetic resonance, highly magnetic resonance will be seen in the MRI. Next, this one is correct. We have to first identify either the client having any phobia like that. Client sign a procedure permit. Here first in the consent form we have to take the sign from client and their what will we say, their attender also. Here attender also. Determine if the client is allergic to shellfish. This will be also we have this is not relevant to this one. Check if the client has prosthetic devices. We have to find out that pacemakers like that. We have to ask and find out that one, because there is in the MRI there is more highly magnetic field is there. There will be attract easily. There is when we go with small piece of safety pin also it will be attracted. It will that much of strong magnetic resonance will be seen in the MRI. Ask the client to empty his bladder. This one also very important too. So here the correct answer is 1, 4, 5. Next, which clinical manifestation would the nurse assess in the client with T12 spinal cord injury who is experiencing spinal shocks? Spinal shock will be happen when the spinal cord injury is there. That is also spinal shock. Which clinical manifestations? Here we are seeing here the T12 injury. Here diaphragm is there, here abdomen, here the hips. So this spot will be called as vast. We will call it as vast. Here lower extremity muscle spasticity, complaints of pounding headache, it is absolutely. Of course, some may have hypertension and bradycardia, but here flaccid paralysis below the vest. Whenever the T12 spinal cord injury, this is the vast. This will be occur. Flaccid paralysis below the vest. This is the correct answer. The nurse walks into the room and notes the male client is lying supine and the entire body is rigid with his arms and legs contracting and relaxing. The client is not aware what is going on and is making guttural sound. Which action should the nurse implement first? It is nothing but seizures or epilepsy. So here first clear the airway. First whenever the when we identify the patient is the seizures, we have to clear the airway first. After that we have to do the another action. So here the loosen constricting cloth, place padding on the side rails, assess the client vital. These are the secondary things. First we have to turn the client on his side. One side we have to turn and then the airway will be clear. So the first action should be taken by the nurse is turn the client on his side. This is the, after that we have to assess placing pad, losing constructive cloth, then check vital signs. This is the second. The client newly diagnosed with epilepsy who works in office asks the nurse, what can I do to prevent having seizures? Which statement is the nurse's best response? Here the client is already diagnosed with epilepsy who works in an office asks the nurse, what can I do? Here I recommend getting about 4 hours of sleep of night. Ask your super. Here this is the correct answer because this Xerox machine has some rays. They have some rays. So it will be causes the seizures. So ask your supervisor to have someone else make copies. Like that we have to find out the answer. Request your employer to wear work area with dim lighting. You should not. These are the wrong answers. The client diagnosed with seizure disorder is prescribed phenytoin, an anticonvulsant. Which statement indicates the client needs more teaching concerning this medication? I will brush my teeth every meal. I will get my DLNT level checked regularly. My urine will turn orange while on. Here what the question is, which statement indicates the client needs more teaching concern? Here, when taking this phenytoin, the urine will not change the orange color. So, when the client answer this, when the client tell this type of questions or statements, there is more need of teaching concern about the prescribed tablets. So, this is the correct answer. Which statement by the female client indicate that the client understands factors that may precipitate seizure activity? Here the female client we are taken. So I should not take birth control to prevent pregnancy. This is not what. I need to limit my. This is also not. I should not participate in a contact. This one also wrong. Next. Here the correct answer is my menstrual cycle may affect my seizure disorder because in menstrual cycle there is a fluctuations of the hormones, so it will be changes in the cerebral cortex, also hormonal changes, and neurons will be affected to the hormonal changes, so it may lead to the some seizure disorders. Already diagnosed with the seizure activity female, so we have to understand this fact. The mother of a child who had febrile seizures tells the pediatric clinical nurse, I am so upset because now my child has epilepsy. Which statement is the clinical best? This is the febrile seizures. So whenever the temperature high means there is chance of the seizures. So your child had a seizure due to a high fever, not due to epilepsy. You have to tell the parent. You never diagnose this your child has epilepsy. These are the febrile seizures. You are upset about your child having epilepsy. Let's talk. This is the wrong one. Epilepsy found. This is also wrong. I would recommend you attend the local epilepsy support. This is also wrong. The nurse is assessing the client experiencing left-sided cerebrovascular accident. Which clinical manifestation? Here the left side means right-sided paralysis. This is the easy to answer, right-sided. Everybody know left-sided CVA means CVA will be happy, right-sided paralysis will be happy. The client is being admitted with rule out brain tumor. Which signs and symptoms support the diagnosis of the brain? Widening pulse, pleasure, hypertension and bradycardia, headache, vomiting, diplopia. Headache, vomiting and diplopia. So this is the correct answer. These are the some previously asked case scenario based in the neurological system. Next which topic we want, please let me know, and please don't forget to subscribe and like, share. Thank you so much.